Welcome to How to Health. Don't forget to subscribe to our channel and leave a like on our video if you've learned something today. We do our best to cover a wide range of health-related questions. Today we're covering gallstones. What are gallstones? More than 25 million people in the United States have gallstones, and 65% to 75% of them are women. Fortunately, for most people, gallstones are silent. They don't cause major symptoms. When they do act up, there are effective ways to address the problem. Gallstones begin with bile, a substance that helps with the digestion of fats and the absorption of certain vitamins. Bile is made in the liver and carried to the gallbladder, a small pear-shaped organ that concentrates and stores it. The fat in food triggers the release of a hormone that causes the gallbladder to contract and release bile into the intestine. Gallstones are solid lumps that develop when the stored bile crystallizes. Most are less than an inch in diameter, but they can be as small as a grain of sand or as large as a golf ball. Most gallstones are composed mainly of cholesterol. The rest, known as pigment stones, are made of calcium salts and bilirubin, a breakdown product of red blood cells. Cholesterol stones form when liquid bile in the gallbladder contains more cholesterol than bile salts can dissolve. Cholesterol stones may also develop if the gallbladder doesn't contract and empty as it should. Pigment stones are associated with certain medical conditions, including liver disease, some types of anemia, and infection of the bile ducts. What are some symptoms? Gallstones may cause no signs or symptoms. If a gallstone lodges in a duct and causes a blockage, the resulting signs and symptoms may include sudden and rapidly intensifying pain in the upper right portion of your abdomen, sudden and rapidly intensifying pain in the center of your abdomen, just below your breastbone, back pain between the shoulder blades, pain in your right shoulder, nausea or vomiting. Gallstone pain may last several minutes to a few hours. Make an appointment with your doctor if you have any signs or symptoms that worry you. Seek immediate care if you develop signs and symptoms of a serious gallstone complication, such as abdominal pain so intense that you can't sit still or find a comfortable position, yellowing of your skin and the whites of your eyes, high fever with chills. You may be wondering what causes gallstones. It's not clear what causes gallstones to form. Doctors think gallstones may result when your bile contains too much cholesterol. Normally, your bile contains enough chemicals to dissolve the cholesterol excreted by your liver. But if your liver excretes more cholesterol than your bile can dissolve, the excess cholesterol may form into crystals and eventually into stones. Your bile contains too much bilirubin. Bilirubin is a chemical that's produced when your body breaks down red blood cells. Certain conditions cause your liver to make too much bilirubin, including liver cirrhosis, biliary tract infections, and certain blood disorders. The excess bilirubin contributes to gallstone formation. If your gallbladder doesn't empty completely or often enough, bile may become very concentrated, contributing to the formation of gallstones. Let's cover types of gallstones. Types of gallstones that can form in the gallbladder include cholesterol gallstones. The most common type of gallstone, called a cholesterol gallstone, often appears yellow in color. These gallstones are composed mainly of undissolved cholesterol, but may contain other components. Pigment gallstones. These dark brown or black stones form when your bile contains too much bilirubin. Factors that may increase your risk of gallstones include being female, being age 40 or older, being a Native American, being a Mexican American, being overweight or obese, being sedentary, being pregnant, eating a high-fat diet, eating a high cholesterol diet, eating low-fiber diet, having a family history of gallstones, having diabetes, having certain blood disorders such as sickle cell anemia or leukemia, losing weight very quickly, taking medications that contain estrogen such as oral contraceptives or hormone therapy drugs, having liver disease. And finally, how to remove gallstones naturally? Talk with your doctor before trying to treat gallstones on your own. Your doctor can help you receive the correct diagnosis. They can also advise you on all of your treatment options. If you have yellowing of the eyes, fever or chills, and intense abdominal pain, seek medical care immediately. Gallbladder cleanse. There are several reasons why gallstones may form. Your liver may secrete more bile than it can dissolve. Your body may have excess pigment called bilirubin, which cannot be dissolved. The gallbladder might not empty completely or as frequently as it needs to. Some people that a gallbladder cleanse or flush can help break up the gallstones and empty the gallbladder. There is no scientific evidence to support these claims, however. The body is able to cleanse and flush itself. Still, some people consume a combination of olive oil, juice, and herbs for 2 or more days. During that time, They're not supposed to consume anything other than the oil mixture. There's no standard mixture or recipe. This mixture can be dangerous for people with diabetes or those who experience low blood sugar. One looked at the role of olive oil and sunflower oil on gallstones. The researchers found that while olive oil had an effect on bile consumption, it did not affect the gallstones. Talk to your doctor before beginning any type of cleanse. It may not be safe for all people. Apple juice. Some people use apple juice to treat gallstones. That's because they believe apple juice may soften gallstones and can help you pass the stones. This claim is spread due to a which detailed an anecdotal account of a woman successfully passing her gallstones with the use of apple juice. There are no scientific studies that support this claim, however. Drinking lots of fruit juice may not be healthy for you if you have diabetes, hypoglycemia, stomach ulcers, and other conditions. Apple cider vinegar. Apple cider vinegar is a popular health supplement that is often included in cleanses. While ACV may have positive effects on blood sugar, there are no studies to support the use of ACV for the treatment of gallstones. There is little evidence that cleanses are needed or effective. Yoga. There are some claims that yoga may help you naturally pass gallstones. Yoga was found to improve lipid profile in people with diabetes. In another, researchers looked at people with cholesterol gallstones and found that people with these types of gallstones were more likely to have abnormal lipid profiles. The researchers were unable to find a connection between these abnormal levels and the presence of gallstones, however. While yoga may help relieve some of the symptoms associated with gallstones, there is no scientific evidence to support the use of yoga for the treatment of gallstones. Milk thistle. Milk thistle treats liver and gallbladder disorders. It's thought to stimulate both organs, but researchers have not specifically looked at the benefits of milk thistle for the treatment of gallstones. Milk thistle is available in pill form as a supplement. Talk to your doctor before using milk thistle, especially if you have diabetes. Milk thistle may lower blood sugar levels in people with type 2 diabetes. Artichoke. Artichoke has to be beneficial for gallbladder function. It helps stimulate bile, and is also beneficial for the liver. No studies have looked at the effect of artichoke on the treatment of gallstones. Artichoke can be steamed, pickled, or grilled. There is no harm in eating artichoke if you're able to tolerate it. Artichoke in pill form or sold as a supplement should only be taken after you speak to your doctor. Gold coin grass. Gold coin grass is used to treat gallstones. It's been linked to reduced gallstone formation. Some people recommend taking gold coin grass before beginning a gallstone cleanse to help soften the stones. You can purchase gold coin grass in powder or liquid form. Castor oil pack. Castor oil packs are another folk remedy, and some people choose to use this method instead of gallbladder cleanse. Warm cloths are soaked in castor oil, which you then place on your abdomen. The packs are supposed to relieve pain and help treat your gallstones. There are no scientific studies to support claims that this treatment is effective. Acupuncture. Acupuncture may help relieve some of the pain from gallstones by reducing spasms, easing bile flow, and restoring proper function. Acupuncture has been reported to treat gallstones, but more research is needed. One was done to look at the effects of acupuncture on cholecystitis in 60 participants. Cholecystitis is inflammation of the gallbladder. Acupuncture was found to relieve symptoms and reduce the volume of the gallbladder. More research is needed to specifically look at the benefits of acupuncture for the treatment of gallstones. Acupuncture is relatively safe. When choosing an acupuncturist, look for a licensed acupuncturist and make sure that they are using new, single-use needles. In some cases, your insurance provider may cover part of the cost. Many cities also have community acupuncture centers. Acupuncture is administered in a room with other people instead of in a private setting. The cost for community acupuncture is often a lot more affordable than private acupuncture. Other treatments for gallstones. Medications and surgery are often used to treat gallstones. Medication. 2 bile acids are often prescribed to dissolve smaller gallstones. Ursodeoxycholic acid, chenodeoxycholic acid. Ursodeoxycholic acid help prevent gallstone formation in obese people who are following very low-calorie diets. It may take up to 2 years for bile acids to treat gallstones. Gallstones may reform when you stop taking the medication. Surgery. Surgery is often the recommended treatment for gallstones. Surgery, known as cholecystectomy, involves removing the gallbladder, so gallstones are not able to form again following this treatment. A gallbladder is not needed for survival, and in most people, the body is able to compensate for the loss of the gallbladder with minimal side effects. Thanks for watching. We hope you left with some new knowledge on this. Don't forget to subscribe to our channel for more health-related answers.